Also, unfortunately, in our system, OSUN is one of the very few states, maybe about 3 or 4 states, that does not have any partners. You see, some other states, they have 5, 6, even up to 10 partners collaborating with them on the insurance system.
It was hours of frank and thorough engagement between the Ocean Health Insurance Agency and healthcare providers under the Ocean Health Insurance Scheme at the last quarter of forum meeting held on Thursday. The executive secretary of the agency, Dr. Akindele, who was presiding over the meeting for the first time, welcomed the service providers to the forum meeting.
Having appreciated you for all your efforts all this while, I also want to thank you for your efforts, especially in getting people to join the scheme. Who is?
Akindele said the agency is poised to drive its advocacy towards getting the informal sector participants enrolled on OHIS.
We're having another look, another dimension. Osun State has about 5 million population. And if you say out of this 5 million population, 250,000 are presently enrolled. That means we have a large pool of about 5 million, of about 4 million people that can still join this scheme. If we have the informal sector joined, then it's going to improve the fund pool of this agency. It's going to also improve whatever comes to the providers. And of course, it's going to increase the scope of operation of OIS.
The event, which was an interactive session, as service providers had avenue of stating the challenges, also had a lecture delivered by staff of the agency.
One of the challenges we need to do is that to go digitalize, that is to go on the electrical medical records, digitalize our health insurance processes, especially the pre-authorization code, the claim processes, and also the vetting processes. As we all know that these are all big and huge responsibilities for the health insurance system. But with the help of Mr. Governor, we are all going digitalized to make all the record processes easier, the electronic processes easier, the enrollment process easier, the vetting processes also easier, and also the payments and reimbursements of all captations and reimbursement to the state healthcare providers easy and seamless in all our operations.
Addressing newsmen, Dr. Akindele reiterated the commitment of the agency to give kingly treatment to their enrollees.
Let us understand why there are problems. We first have to understand where there are problems and see how we can solve those problems. Now, after solving the problems, they all know the rules, they know the regulations of the services. If they now go far of that, then we're going to use the law against them.
He also revealed that Governor Ademola Adeleke has approved free enrollment of 19,000 pensioners across the state.
The governor of Osun State, Senator Ademola Nuruddin Jackson Adeleke, has given us the order that we should enroll all pensioners in the state. That their health is very sacrosanct. You will see that all of them came out en masse to vote during the election to exercise their franchise. They also have to be compensated. You understand? And it's not even a compensation, it's their right. They have rights to good health at that age. I haven't served the state for that long.
A participant at the event has this to say.
They should also encourage them by making sure that once they pay maximum 2 weeks, they are able to access service. Okay. One other way which I suggested is that the drug store should be well managed so that providers can be encouraged to patronize them and get their drug supply from them.
It has been about 2 hours of engaging, frank and thorough discussion between the service providers and Osun Health Insurance Agency. And the matter is all about how to improve the service given to enrollees of Osun Health Insurance Scheme. The Executive Secretary, Dr. Akindele, also used the avenue to announce that Governor Ademola Adeleke has graciously approved the enrollment of 19,000 pensioners into the scheme. From Osogbo, Jarity Amiyu, Inside News TV.